Hello and welcome to Fertile Minds. I'm Dr. Daniel Lantsberg, a fertility specialist at Melbourne IVF. For many people, the best and maybe the only way to start the day is with a cup of coffee. Something I'm often asked is whether coffee or caffeine in general should be completely booted out when trying to conceive. Today, I'm going to discuss all things coffee and conception. Keep watching. So what is the impact of caffeine on females? High caffeine intake, typically defined as consumption of more than 200 to 300 milligrams per day, has been associated with reduced fertility among women attempting to conceive. This is thought to occur due to caffeine's potential to disrupt hormone levels involved in the reproductive process, including estrogen. Such hormonal changes can affect the regularity of ovulation, which is crucial for conception. Moreover, there are some reports about excessive caffeine consumption during pregnancy and while trying to conceive. There have been linking caffeine to a slight increase in miscarriages. The risk, although controversial, is particularly noteworthy when the daily caffeine intake exceeds the recommended levels, highlighting the importance of moderation in caffeine consumption during preconception and pregnancy. For women aiming to optimize their fertility, it is advisable to monitor and limit caffeine intake to support the reproductive health and minimize potential risks. Let's talk a little bit about the impact of caffeine on males. The impact of caffeine on males' fertility is complex and varies across different studies. Some research suggests that high caffeine intake could potentially lower sperm count, reduce motility, which is the movement of the sperm, and affect sperm morphology, which is the shape of the sperm, all indicating a possible negative impact on sperm quality. However, these findings are inconsistent with some studies that found no significant effect between sperm parameters and caffeine intake. Regarding testosterone levels, caffeine may potentially have a minor influence, but typically does not lead to significant changes in fertility outcomes for men. As with women, moderation with caffeine consumption is generally advised for all men trying to conceive, emphasizing the importance of a balanced lifestyle choices to support optimal reproductive health. So, what's the recommendation? When trying to conceive, it is recommended that both men and women limit their caffeine intake to less than 300 milligrams per day to optimize their fertility. In practical terms, this means 1 or 2 cups of coffee a day. Alongside managing caffeine consumption, adopting a balanced lifestyle that includes a healthy diet, regular exercise, avoiding smoking, avoiding alcohol intake, can also further support your reproductive health. Consulting healthcare providers for professional advice is crucial, as they can offer tailored recommendations based on the individual's health conditions and fertility goals. Practical tips include monitoring your caffeine content in various foods, drinks such as coffee, tea, soft drinks, and chocolate, and considering alternatives like decaf options and reducing portion sizes to manage caffeine intake effectively. These strategies can help individuals enhance their chances of conception by promoting overall well-being and minimizing the potential risks of fertility-related risks associated with caffeine consumption. Thanks all for watching. For all things fertility, please feel free to subscribe.